Hey guys, Dr. Davin Lim, board certified dermatologist. Today's topic is super important and it's very common. It is dandruff. So guys, dandruff is a common condition. It usually occurs in the teenage, but usually young adults. In the beginning, neonates or babies have a similar condition known as cradle cap, and there is a cross between seborrheic dermatitis, which is a common rash which affects the face, and dandruff, which is basically seborrheic dermatitis affecting the scalp. Now, dandruff can be a very embarrassing condition because you can have flakes, like small flakes or huge flakes, especially on a dark t-shirt. It really stands out. So guys, here are my top tips in regards to how to effectively treat dandruff. Firstly, we've got to understand the etiology of what causes it. It's due to an overgrowth of a yeast called Salicylic. And this yeast is a commensal on skin. In other words, it occurs in normal individuals, but in a smaller population compared to dandruff or seborrheic dermatitis. So we've got to acknowledge that the yeast that causes it is a normal part of your skin. When overgrowth occurs, that's when you can get dandruff flakes. So let's start. Dandruff, how to treat. Firstly, you can use a simple shampoo that contains selenium sulfide. So Selsun Gold and Selsun Blue contain selenium sulfide, and that can be found in most supermarkets and pharmacies. In Australia, at least, we do not need to use a prescription to buy selenium sulfide. So my go-to, Selsun Gold, Selsun Blue. What happens if that doesn't work? Well, from there you can use something called ketoconazole. Ketoconazole comes in as a 2% wash and is commonly called Nizoral or Nizoral. The application is basically 3 to 4 times a week and then maintenance every second day for about 2 to 3 weeks and then as needed. So remember guys, when you're using medicated shampoos, it's extremely important to repeat the process because when you use active ingredients against this yeast, all it does is it decreases the population of the yeast from abnormally high to normal. But over time, this yeast can proliferate, and as a result, you can have dandruff. So with whatever that you're using, you've got to have some kind of maintenance schedule. The maintenance schedule for each one will vary, but as a rough guide, maybe once to twice a week, once it's under control. So if these two don't work, what else can we use? We can use something called zinc pyrithione. Once again, this is widely available in many pharmacies, and that can be effective in some patients. Now, if you've tried all three and you're really struggling, a dermatologist can help. We can prescribe things like coal tar. So coal tar shampoo or coal tar together with what's known as salicylic acid. Salicylic acid often is combined with coal tar because it helps exfoliate the skin. So salicylic acid can improve turnover, decrease flakes, and accelerate your program. If you're really struggling, a dermatologist can prescribe you what's known as a compounded solution. So a compounded solution may contain something like 3 to 4% coal tar with 3 to 4% salicylic acid. Some dermatologists may add some propylene glycol to increase the penetration, and others may add something as simple as 1 to 2% olive oil to improve the formulation and make it easier to use. Lastly, we may prescribe something called itraconazole. Itraconazole is a form of ketoconazole. It's an antifungal. It's slightly more powerful than ketoconazole, but that can be taken orally. So ketoconazole, if you take it orally or by mouth, it can have problems such as liver toxicity. However, using a shampoo itself should not pose any trouble. So if you have persistent, resistant dandruff, your dermatologist may prescribe you a safer alternative called itraconazole. So guys, I hope you liked that video. It's a super short but very important video. Please like, comment, share, and subscribe. I'll see you next week.